Now, to walk us through the position of the resident doctors in Jos is the NMA chairman, Plateau State, Dr. Innocent Emmanuel. He joins us live via Zoom. Good to have you join us, Dr. Emmanuel.
Good to have you too. Thank you for putting me on to speak. Thank you so much.
So we saw that report from our correspondent Funam Joshua in Plateau State. He talks about what's going on now because of the strike. We understand that the strike has been called off, but before we get to that, paint for us the picture of exactly what you're seeing in hospitals in Plateau State as a result of the insecurity.
It is quite unfortunate what is happening in our land, what is happening all over Nigeria, and particularly what is happening in Plateau State. In the hospital, we receive, in the mortuaries, we see so many dead bodies. In the wards, we see people that have varying degrees of injury. Some injuries are mild, some are moderate, and some are so severe and mutilating. And that is so worrisome to us as doctors. We doctors are in the hospital trying to cater for the needs of the people. And we're a little happy if we see somebody coming to the hospital with natural causes of disease. But this is quite disheartening, seeing people coming as a result of human being inflicting such degree of injuries to people, that injuries that will actually make for life, or injuries that could lead to death. And they are there in our mortuaries, and some have been buried in mass graves. And we are still catering, giving health care to those who are still alive, and trying to see that we keep them alive so that they could be helpful to this country.
And one can begin to understand how difficult this must be for you, especially because we're dealing with other kinds of diseases as well in the country. There is the COVID-19 outbreak, there is cholera, and there are just other kinds of diseases as well that you have to attend to, and then this. But we understand that the Association of Resident Doctors in the University Teaching Hospital in Jos have written to the National Association of Resident Doctors for a compassionate waiver, just so they can attend to this. What would that do? How far can that go in helping the situation? And what about the state government-owned hospitals? Are they doing the same thing?
I am speaking presently as the chairman of the Nigerian Medical Association, Plateau State branch. The Nigerian Medical Association is an umbrella body for all doctors in Nigeria. Now we have other bodies within NMA. NMA represents all bodies. However, we have the body of consultants, and we have the body of resident doctors, and the body of other doctors. For at the moment, in the University Teaching Hospital, we have two major bodies, the consultants and the resident doctors. The resident doctors are on strike for germane reasons, and we wish that the federal government will listen to their plea and call back the resident doctors. The resident doctors have reasons to go on strike, and this has been going for 3 weeks without any positive response. Only recently we saw a circular, a very inimical circular, that is going to add assaults to injury, talking about no work, no pay, when we should be talking about how to resolve the strike. So presently, it's only the consultants that are working in the hospital, and the consultants are very few, and there's a limit to which the consultants can do. The resident doctors are those people that are younger and more agile in doing their responsibility, in taking the responsibility of healthcare in this nation. So now the states have casualties from these senseless attacks and senseless killings. We will have been optimally functioning as a hospital, the Jos University Teaching Hospital, if the consultants and residents are together working to see how they can cater for the health of the masses, together with those that are coming from natural causes and those that are having these problems as a result of the attacks. However, we are depleted. We cannot function optimally. So at this moment, I'm calling on the federal government that they should do the needful. What the resident doctors are asking are not things that cannot be done by the federal government. They are things that are within reach, things that border on their hard-earned efforts that they put into the healthcare. We can see our doctors traveling, leaving this country to other climes just because they are not secured. Their welfare is not secured, and also their security is also not guaranteed. You see, we live under this constant fear of being kidnapped, constant fear of being attacked and killed. So these things are not actually good for our country. At the moment, the doctors' NMA cannot function optimally because some of our doctors are on strike. So the bulk of the patients go to the Plateau State Specialist Hospital and also to Bingham University Teaching Hospital and other private hospitals and other hospitals within the within JOS. And coupled with that, also we have we have the curfew. This curfew limits movement, and the victims are at risk if you cannot be moved to the hospital, no matter what type of illness that you have. If you cannot be moved to the hospital as quick as possible, you won't get the optimal of care. And also, we face the issue of too many patients. There are a specified number of bed spaces per hospital. Now, these bed spaces get filled up because of this unnecessary attacks that happens and the reprisals that follow. So
you paint a really devastating picture for us here, and we really do hope that the government, all stakeholders come together to resolve this, just so we can have a way forward, especially for the healthcare system that is already overstretched. Thank you so much for talking to us, NMA Chairman, Plateau State, Dr. Innocent Emmanuel.